Iowa is now in the COVID red zone with an unyielding and exponential spread of the virus, according to the White House Coronavirus Task Force. The positivity rate there is an alarming 50%, according to Johns Hopkins. 50. The state also reported 40 deaths yesterday, which is a new record. One doctor in Des Moines saying the situation there just keeps getting worse.
I think there's a sense that no one is listening to us. And it really does feel at times as if, we're on the field, we're fighting fires, and yet people continue to set fires. We feel like we've been doing this for many months and had hoped that there was an end in sight. But now it feels like it's even worse than it's ever been, as opposed to getting better.
NBC News correspondent Gabe Gutierrez is in Des Moines with more on the fires that healthcare workers there are fighting.
Allison, it's an increasingly dire situation here in Iowa. According to Johns Hopkins University, the positivity rate in this state is hovering around 50%. That means about half of the COVID tests that are being done are coming back positive. It's a stunning statistic, Allison, when you think about in New York City, they're shutting down schools, and the positivity there is hovering around 3%. Here, it's around 50%. Doctors and nurses we've been speaking to here in this state are worried about what happens in the coming weeks and months. Over in Des Moines, several hospitals there have full ICUs. Where I'm at in front of right now is a hospital in Knoxville, Iowa. This is a more rural area. This hospital does not have an ICU. They have a makeshift COVID unit, basically 8 to 10 beds that they've managed to seal off to treat their COVID patients. However, they are either at or past capacity, and they expect the situation to grow more serious in the coming weeks. And the challenge for hospitals like this is, not just a question of bed space, but an issue of funding and staffing as well. But around Iowa, there's been controversy over the last few months. The Republican governor here has, up until several days ago, had resisted ordering any sort of mask mandate. She did put one into effect on a limited basis, basically saying that if you were within 6 feet of someone for more than 15 minutes, you had to wear a mask. Though there are questions about enforcement, and indoor dining remains open. So some critics in the state do think that these measures are too little too late, or that don't go far enough. But again, Allison, the doctors and nurses that we've been speaking with, they are just stressed, and they worry what will happen this winter, this Thanksgiving, as people gather indoors, and whether their space here and their staffing will be able to meet the need. According to the CDC, the COVID death rate is more than double in rural areas than it is in non-rural areas. And here in Iowa, the state just reported a daily record for COVID deaths.
Businesses in Oregon forced to close their doors for 2 weeks to try to get COVID under control. That state's reporting more than 1,000 new cases for the fourth time in just the past week. But as restaurants and bars there closed, there's new concern about whether Oregonians can feed their families and pay their rent or mortgage. The Oregon Food Bank telling lawmakers in a new op-ed that they have to act to prevent mass displacement and homelessness. NBC News correspondent Antonia Hilton is at a food distribution site in Portland. Antonia, the Northeast Emergency Food Program where you are says their food distribution is up 1,000% since the start of this pandemic. Tell us more about what's going on there and with folks in that community.
So, Allison, here in Portland, that freeze on businesses is expected to last at least 4 weeks, could be extended longer than that. And so people are starting to get laid off. I spent the day yesterday with servers who were getting laid off left and right. And so people who manage these food distribution sites here are expecting to see their lines get longer. At this site specifically, they're estimating about a 25 to 30% increase over the next couple of days, and they are gearing up their resources to manage all of that. But, a key piece to note that, touches on that 1,000% increase that you mentioned before is I was told at the beginning, before this pandemic began, they were seeing about 80 to 120 families every day. They'd come into a building over here to my right. They would quickly grab sort of regular food pantry food and head out. Now this is a full production. As you can see, they have cars here. Hundreds of people have been served throughout the day, and they're expecting it to only get harder and more strained ahead of Thanksgiving.
Antonio, we mentioned the Oregon Food Bank op-ed off the top here. What specifically are they asking Congress to do? What kind of help do they most need?
So the Oregon Food Bank wrote that op-ed in the hopes of lighting a fire under lawmakers at both the state and federal levels, actually. They feel that people need to urgently act right now, that there has not been enough attention to both housing and food insecurity issues that are, of course, tied together as people in the state lose jobs, lose their wages. And so their hope is to see people not only act to make resources available to individuals and families in need, but to act to make sure that they can live and be in safe housing as we head into this dangerous period and states across the country struggle to control this pandemic. I spoke to the program manager of this site, AJ Scipio, this morning, and I want you to take a listen to what she told me.
I think it's already tough, and it was tough looking forward to the holidays, and now with another freeze in place, it's really difficult. And I think a lot of people are afraid. I think a lot of people are in a position where they just don't know what to think. They don't know what to do. They don't know where to turn. We have a lot of people who have never accessed a food pantry, a food bank ever before in their lives. I've gotten reports from some of my staff members of people who have actually been in the lines out here having panic attacks because they are so afraid of what the process is going to be like.
The program managers and the volunteers here all echoed exactly what AJ just said here, that a lot of the people that are starting to show up in their cars in these lines are first timers. They have never before needed to access a food pantry before, which I think tells you a lot about the crisis that we're in at the moment. They also say, you know, every day that goes by that we still do not have a federal level aid package available to people losing work and struggling to support their families, these lines get longer and the resources available to these sites get more and more strained. Back to you, Allison.
Well, Antonia, it is such a tough situation there in Oregon. Thank you so much for just sharing a little bit of what folks are going through there. Appreciate it. Still planning to travel this Thanksgiving? The CDC now recommends you avoid it. Have no choice. They've got some guidance for travelers and anyone planning to celebrate Thanksgiving next week. NBC News medical contributor and infectious disease physician Dr. Naheed Bhadelia joins me now. Dr. Bhadelia, a CDC official says there's no more important time than now for each and every American to redouble our efforts. But what if you have to travel next week? What do they, the CDC, and what do you advise?
Good evening, Allison. Yeah, I want to start with the stark warning again that the CDC gives, which is right now is the year. This is the year that we forgo that travel, partly because the numbers are looking terrible. 79,000 people are hospitalized right now, and we already are at 1,900 deaths as of yesterday. We're going to reach 2,000 deaths a day pretty quickly. But if you do have to travel, here are some of the things that they talk about. If you need to travel, make sure that, well, wherever you're going, you check what rates of infection test positivity there are. You want to make sure you're not going to an area of increased you're not bringing potentially higher risk of infection with you, or you're not going to another place where you might potentially get infected and bring the disease back. When you're traveling, make sure you're using personal protective equipment, masks, face shields if you have them. They're worried about those travel hubs because that's where a lot of people gather and there could be transmissions there. They also talk about the fact that you should really, really look at limiting the number of people that are in that household. The greatest amount of transmission is in those indoor spaces, and family transmissions are pretty common from the studies that we've seen, across this entire pandemic, throughout this entire time. Increased ventilation. If you do have 5 or less people in your room, open those windows, make sure you keep those masks on and keep those distances at 6 feet or more. And then only take those masks off when you're eating or drinking. And the last bit is, when we shout or sing, we tend to put out a lot more of that virus, a lot more of those aerosols or droplets. So make sure that we are not doing loud shouting or singing that might make that worse. So there's some steps, but the biggest thing, the way that you can make sure that you're not bringing that risk home is quarantining beforehand and potentially getting tested if you have access to that.
Doctor, a lot of people think, okay, I'll get a test, then I'll go see my family, then I'll get another test when I get there. Why is the CDC saying that strategies like that are just not a great idea?
Yeah, Allison, it's because, it's all of those are one small piece of a large number of actions that you need to take to make sure you reduce the risk of bringing home the disease. No one strategy is perfect. It's like a Swiss cheese model where there are holes in every strategy, and your goal is to do multiple steps to make yourself safe. So the reason why is that most tests, whether the PCR test that your doctor offers you or the rapid antigen tests that are now available, all of those tend to be less accurate in people who are not symptomatic, partly because you don't know if you turned out to be negative because you don't have the disease, or you turned out to be negative because you're so early in your disease that the tests don't pick that up. And not only that, but with rapid tests, the antigen tests, those tend to be, 70 to 80% the sensitivity of the PCR test that your doctors are doing. That means that they're missing about 20 to 30% of the cases that a PCR test would have picked up. So those are all the reasons where you got to make sure you quarantine, make sure you wear those masks, and the test is just one more thing you add to the equation to make sure you're not taking that infection home.
HHS is launching a program in 5 states using the rapid test that helped the NBA have a pretty successful season. Early on, we weren't sure how reliable those rapid tests were. What do we know about them now? Have we learned more?
Yeah, Alison, currently the rapid tests that are on the market are something called the antigen test. So as opposed to the PCR test that I just talked about that look for the genetics, the antigen tests tend to be, they're helpful when they're positive. Again, but same as the other tests, when they're negative, particularly with antigen tests, you don't know if they're negative because the test is not as sensitive as the PCR, or if they're negative because you're truly negative. And hence the recommendation in all those cases is that it could be used as one way. If you deploy repeated testing, that's one way of reducing transmission, but you have to make sure that you also continue to do the masking, you continue to do all the physical distancing and other aspects. I think rapid tests have their place in our society, Alison. They will help us reduce transmission, but they can't be done alone. No one thing is a silver bullet.
Dr. Bedelia, New York City schools went remote today. A lot of people, especially parents, questioning why schools are closed when bars and restaurants, even gyms, are still open. Your thoughts here?
Yeah, I think I'm going to join the chorus of a lot of public health folks who've said the same thing. We know that bars and restaurants, indoor bars and restaurants, places where people are speaking loudly, they have their mask off for a long period of time, you're more likely to transmit the disease. And schools, surprisingly, we haven't seen as many outbreaks. All those bets are off, though. When there's a lot of community transmission of this disease, the risk of both schools and bars goes up. So if you were to close one in New York City or New York State right now with their test positivity, I know one would have said, let's close off the areas that are more risky, which is the bars and restaurants, and continue the schools. That's not to say that schools, when they continue in this period of time, what I should say is that they should still get the support, because as community numbers go up, the risk of potentially kids or teachers getting sick goes up as well. So if we're keeping the schools open, we should do that with additional support to make sure there's no transmission within those spaces, make sure there's ventilation. And here's a place where that rapid testing that we just talked about could be so helpful in making sure that we're keeping schools safe as well.
Dr. Bedelia, thank you for all your expertise, for all your advice. It was really nice to see you again today. Appreciate it.
You too, Alison.
New York City public school students finishing their first day of remote classes, the nation's largest school district, sending kids back home today because the city's average COVID positivity rate hit 3%. MSNBC anchor Yasmin Vasugian is at Tottenville High School in Staten Island, an area with the highest positivity rate in the entire city.
Yes, so Alison, I'm standing in front of a high school here in Staten Island, Tottenville High School. It's pretty eerie to see, right? Yes, we're later in the day right now and students wouldn't necessarily be here at this time, but I've been here all throughout the day. I've seen barely anyone on the school grounds except for some leaf blowers that have been cleaning up the grounds. Otherwise, no students at all because schools were shut down, going to totally online learning. That's because we reached this 3% threshold in this city. The mayor has deemed that 3% threshold the time in which he would have to start shutting down schools throughout the city, despite the fact that the positivity rate inside schools is much lower. So let me talk to you about some of those numbers. 7.6%, that is the positivity rate in this area. 3%, that threshold throughout the city. 0.2%. That is the positivity rate in schools throughout the city. That's why a lot of parents right now are up in arms asking, why is it that schools are shutting down with such a low positivity percentage, considering the fact that so many bars, restaurants for indoor dining, gyms are remaining open? Here's some of what some parents told me a little bit earlier today.
It's confusing. I don't understand the numbers right now. I don't know how they work anymore. My questions are like this. Why are we still handling coronavirus like it's March and April when we're in November and things change?
I think it's difficult for parents. I'm a working parent, so I'm here getting my Starbucks, then going into work. My husband's working from home while he's trying to log them in, and it's a lot of work for all of us.
And it's incredibly hard to administer online learning and get your job done. I heard that a lot throughout the day. One other issue I want to talk about, I talked about the closure of restaurants and bars and gyms. The mayor said it's only a matter of weeks before that actually happens. Now, the issue for them, though, is they subsequently are going to have to figure out a way to bridge that gap and stay closed and keep their lights on and pay their bills. And that's incumbent upon the federal government and Congress to get relief to a lot of these small businesses, relief that we haven't necessarily seen yet. So a lot of these small businesses will be figuring out a way to get that relief done while schools get reopened in this city. And the mayor has said it'll be at least through the Thanksgiving holiday until they can get schools open once again, Allison.
Are the kids all right? That's the name of a new report from the California Partners Project. It shows just how important socializing and interaction are for young people and how teens are particularly vulnerable right now. NBC News senior national correspondent Kate Snow talked with some of the teens in that actual report about their biggest struggles being stuck at home during this pandemic.
I definitely feel more disconnected.
46 teenagers in California, ages 14 to 17, talked with researchers and kept journals.
Raise your hand if you'd like to go back to in-person learning.
With the permission of their parents, Serena and her brother Isaac, Muna, and Marley came out of anonymity to talk with us.
I'm definitely not as happy as I used to be. I'm always talking to people, socializing, so that's like a big part what makes me happy. I can't do that as much, so yeah.
It's hard.
The report finds teens are experiencing tremendous loss due to school closure and social isolation. Muna misses cheerleading.
I'm not looking forward to going to like competitions or games and things like that.
In the study, those who had diagnosed disorders before the pandemic were now more symptomatic, and all of the teens were showing signs of minor depression, anxiety, and worry. 65% said they got little to no exercise over 1 week, and most are connecting with friends through social media and gaming, often spending hours online. One boy in the report said, "My use of social media is to numb my feeling, not feel something else."
So raise your hand if you spend more time on screens now than you used to. Everybody? Okay. Raise your hand if you think that's a bad thing.
Even during our interview, their attention was sometimes split.
Isaac, I see you looking down. I don't know what you're looking at.
My bad.
When you're supposed to be watching a Zoom class, are you sometimes on the phone?
I'm in class in Zoom, and then I have my phone positioned off to the side, and I'm FaceTiming with my friends.
It's hard to be a teenager trying to form an identity and gain independence in a shutdown.
You're telling them you can't really separate from mom and dad the way you want to. You can't just go hang with your friends in town. You will have to understand that those stressors are very real.
We used to tell kids to stay off screens. We used to try to limit screen time. Now we're putting them on screens to do school.
What's really important is it needs to be structured. It needs to be organized. Screens still, even during COVID, shouldn't be out during dinner time or meal times. That there have to be no screen times for every family.
And for parents feeling like they can't break the spell screens have cast on their kids, the report offers this advice. Be a role model. They notice if you're constantly on a screen, too. Brainstorm ideas for non-screen activities. Emphasize healthy eating, sleeping, and exercise, and encourage other hobbies or interests. Serena's been playing soccer. Muna got a job. Marley's in a church youth group. Isaac's hoping for a football season.
For a good hour and a half every day, I just forget about the virus and I forget about what's going on around me. And I'm a kid again.
Things feel normal again.
Yeah.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.